Hey, everybody. Thank you for joining us. Much appreciated. It's going to be a wonderful hour talking about body contouring procedures here in plastic surgery. Get your questions ready and fire away. Don't be shy. Thank you, everyone, for joining. Please share the link with your friends and people that you know who will want to have plastic surgery this year or even next year. We're contemplating getting all sorts of procedures, including mommy makeovers, tummy tucks, breast reduction, gynecomastia surgery for men, liposuction, lipo 360, ab etching, fat transfer, all of the above and beyond. And patients who've had massive weight loss definitely get a full body transformation. So, hello, Leo. Thank you very much for joining. Post your question. All right. Wonderful, wonderful, wonderful. So we had a wonderful case yesterday. I did a, all right. Terry is saying May 2nd is my day. Yes, yes. Looking forward to it. Yesterday we had a wonderful case. We did a mommy makeover, and for her specific procedures, we did a combination of lipo 360, fat transfer to the buttocks and hips, and also a Montplasty to elevate and contour the fupa area, and a drainless tummy tuck. So it was beautiful, wonderful. I will be seeing her in the office on Modupe. Hey, joining in from way over. I'll be seeing her in the office on Monday, and then she'll be able to head back home. She flew in from out of state. So, hey, LaWanda Wilson, how are you doing? Nice to see you. Thank you for coming in for your 6-month follow-up. It's amazing. I can't believe it's already been 6 months. Not too long ago, you were asking questions on TikTok. So now she's 6 months post-op, doing great, loving it. Nadia Zayan, it's hard for me to see. I'm coming to see you soon. Wonderful. Thank you very much, Terry. I appreciate the roses and the gifts. You're coming to see me soon. Looking forward to taking care of you. It's always a pleasure getting to meet you guys in person. Today I had a telehealth consultation. So again, for those of you who are out of state, are not able to come in for an in-person consultation at the first visit, we start with a virtual consultation. So today I had one. She had been following us for quite some time on TikTok, and she is looking forward to getting her surgery in May. So we're going to get her ready to go. A couple of things that I do want to point out, and we've talked about this already on these lives. Of course, it's always important to be able to repeat, the different requirements. Smoking. So if you are a smoker, it is imperative that you quit smoking. You have to stop smoking at least 3 to 4 weeks before surgery, and then 3 to 4 weeks after surgery, depending on the extent of surgery that we're doing, maybe even longer after surgery for you to heal well. Messy comment queen. Well, LOL here. I am always curious about plastic surgery, and I'm in Houston. Wonderful, wonderful. Thank you for joining us. Like I said, I'm a board certified plastic surgeon. I practice here in Houston, so you're local. And I do all sorts of body contouring procedures. I do facelifts, neck lifts. I also do eyelids, so facial rejuvenation, breast surgery, breast reduction, lifts, augmentation, either with implants or fat transfer. I do liposuction, lipo 360. I do arm lift surgery, thigh surgery, thigh lift surgery, back lifts, body lifts, pretty much everything to really contour the body. So if you've lost a significant amount of weight, I've had some patients who've come in who've lost over 100 pounds. They've got a lot of extra loose skin that is really bothering them, despite all the exercise that they're doing. none of that is actually going to get rid of that skin or have it contract. So especially getting them to come in so we can do their assessment, get them on the schedule to do their body contouring, remove that excess skin is a life changing procedure for them. So definitely ask away. I'm happy that you were able to join us today. If you're not following Deigni Plastic Surgery, like us and follow us on TikTok. I'm also on Instagram, and I am starting to build a YouTube channel. It does take a lot of work, though. And so I'll keep working on videos and producing some content so that you guys can get some good, valuable information. All right, so Sheila Sterling is saying virtual. You'll hear from me by next week. Excellent, wonderful. We're looking forward to it. We start with virtual consultations, absolutely, for anybody who's out of town, out of state, even out of country. And we are always happy to be able to get you guys in for your surgeries. Martha Nala, I have been doing a lot of research and shopping around. I want to get a tummy tuck. Wonderful. I do the drainless tummy tuck technique, which allows you to have a much faster and smoother recovery. My patients walk upright within the first 3 to 5 days of surgery. The ones who are more on the later side are just walking hunched over because they're afraid. And whenever I see them in the clinic, I go ahead and force them to walk straight. And they see that you're not going to hurt anything, pop anything. I'm not having you do backflips and really, really stretch those incisions. But the fact that I do that drainless technique, I put plenty of sutures inside that distribute the tension all over, which makes it easier for you to actually walk straight up without pulling on the bottom incision. So that's one of the wonderful advantages of the technique that I use. I also inject all of my patients with Exparel medication, so that really decreases your need for narcotic pain medication. It really makes your pain level more comfortable. On a scale from 0 to 10, 10 being the worst, I want your pain to be no more than 3 or 4 out of 10. That means you're comfortable. You can feel like a little bit, maybe you can see have a little bit of discomfort, maybe a little aches here and there, but nothing to where you can't sleep, your heart's racing and things like that. If your pain is maybe a 7 or above, your pain is not adequately controlled, so we just adjust. And that is through communication with us. And I talk to you the night of your surgery. So you get surgery with me. Usually I'll wait about 3 or 4 hours for you to get back to either your hotel, Airbnb, friends or family, or home. And then I'll call you or your caregiver, make sure I get some good information as to how you're doing, answer any questions about your care that you may have forgotten or your caregiver may have forgotten, and make sure that your pain is well controlled. So we take care of you. Maite Flores 1454. Hello, do you do muscle repair also, and in what surgery? I do. So when I do the drainless tummy tuck or mommy makeover with a body lift, hip lift, buttock lift, and tummy tuck, I go ahead and do your muscle repair. And I inject, like I said, Exparel to get your pain level down so that your recovery is a lot easier and smoother. Most of my patients will typically wean off their pain meds usually within 3 to 5 days, which is fantastic. Chris, do you have to be a certain BMI? Yes, the max BMI is 35. So let me give you some examples of that. If you're 5 foot tall, your max weight will be 179 pounds. If you're 5'4", your max weight will be 204 pounds. If you're 5'8", your max weight would be 228 pounds. So it's based on how tall you are and how much you weigh. You can easily go on Google or any internet search engine that you prefer and just type in BMI calculator, put in your height and your weight, and you'll be able to figure out what your BMI is. Thank you for your question. And thank you, everybody, for participating. Thank you, Lawanda, for answering that question. I appreciate that. We got some patients who are faithful listeners, and even after having their own surgery, they're still participating here and sharing their experiences with others. So we look forward to meeting you guys. Our TikTok family is growing. I love it. We're also looking for you guys on Instagram and YouTube. Okay, thank you very much for the thumbs up. Ask any questions that you might have. I'll be happy to answer those for you. Okay. My goal with these Q&A sessions is to get you as much information as you can to make you comfortable in choosing who you want to have surgery with. And then if it's, of course, I would love for you to choose me, but if it's not me, for example, if you're not able to travel to the US or to Houston, if you're out of state, out of country, and you choose somebody else, by all means, please make sure that you do your research, you're well equipped, you understand the differences between the different procedures. I do have patients that come in and still don't know, what a liposuction is versus, thank you, Joyce Brown, liposuction versus like a tummy tuck, what's going to help them achieve the better results. A breast lift versus an augmentation, if they need a breast lift and things like that. And that's why it's very important that you don't have to be the plastic surgeon. Of course, you don't need to go to med school and residency and do that stuff, but there is some level of understanding of what the limitations of each procedures are. And so you can actually have a much more in-depth conversation with whoever it is that you decide to have surgery with. So Mr. Yum, where can we see before and afters of male patients? I have a few. The majority of my patients are female, just because that's how it is. I've had a few male patients come in and get surgery. It's just the norm, I guess. A lot more women get surgery than men, but I'm happy to have you come in. Put in your information, by the way, in the bottom left of the screen. There should be a lead form. Put in your information, we'll reach out to you. If you're in the Houston area or able to travel to Houston for your consultation, we'll do an in-person consultation. Otherwise, we'll start with a virtual consultation. In male patients, I do the full gamut, a full body lift. I do chest surgery as well. So if you've got man boobs, I go ahead and reduce those, make it look much nicer, flatter. Contour the chest area, the pec muscles. I also do ab etching, things like that. So it all depends on what you want. I also do fat transfer, depending on where you would like to have that fat transferred. So there's plenty of procedures that we do. It's just that 99% of my patients are women. So I don't have that many before and after pictures because I just haven't really operated much on men. But it's the same technique, same procedures. And so always happy to operate on men as well. Vicky Aisu, how long do you have to wear the faja after a tummy tuck? You do not have to wear a faja after a tummy tuck. I put you in a binder. The reason being is the swelling is reduced with my drainless technique. But regardless, if you are in a compression garment, which will be either in the binder, if you want to wear a faja, you can. You'll probably be in it for about 4 to 6 weeks, and then you'll be off. Marthinella. Okay, I would love to get more information, but I live in Pennsylvania. Not a problem. We get patients that come in from all over the U.S. They fly in from New York, California, New Jersey, all those areas. We also have people that drive in. The other patient that I worked on, did a mommy makeover last week. She drove in from Florida. So people come in from all over the place. Like I said, we will start with a virtual consultation for you. Put in your information in the bottom left of the screen there, and we'll be happy to take care of you, okay? All right, thank you very much for participating. I appreciate that. Okay, so Tina is asking, would you do these procedures on someone on blood thinners? So I've operated on patients who were on blood thinners before. It is on a case-by-case basis. It all depends on why exactly you're on the blood thinners, how long you need to be on those blood thinners, and if you can be safely removed from those or not. So depending on your particular situation, we can figure out what needs to be done so we can get through the surgery safely. But yes, I've operated on patients who have been on blood thinners before, and they've successfully recovered. Okay, so Ty Banks wants to know too. No problem. Yes, definitely. So hopefully I answered the questions. Yes, I just did. Sorry, I didn't know which one you were referring to. But for the blood thinners, absolutely. I've operated on patients who have been on blood thinners before as well, or who are currently on blood thinners as well. Ebony Essence School. How much is the mommy makeover? So the mommy makeover varies anywhere between $15,000 to $25,000 or even $30,000. It all depends on everything that you put in. So if you want more of like the full, upscale mommy makeover where you get breast surgery, breast lift, breast implants, or breast fat transfer, you do the drainless tummy tuck. You can also get a BBL, Lipo 360, and maybe some work on the thighs. So a big transformation that will be more towards $30,000 mommy makeover versus, for example, a combination of Lipo 360 and a tummy tuck. The drainless tummy tuck will probably be more towards the $15,000 range. So definitely give us a call. Put in your information on the bottom left of the screen there, and we will be happy to discuss it in greater detail with you. Tamika Van Shea, Jay, thank you very much for joining. Post your questions, and I'll be happy to answer them, okay? Our phone number is 281-724-3138. If you'd like to give us a call, Monday through Friday, 9 a.m. to 5 p.m. Or text us at that number as well. All right, very good. Let's see here. Please share the link with your friends so that we can actually get a very good session, Q&A session. On Tuesday, we had a very nice one. We had plenty of other questions that I hadn't received before, so it was really entertaining and nice to be able to get some fresh content and fresh questions. D. Edwards Daily Pay. I'm 5'2", 172. 5'2", 172, you would qualify for being below the BMI of 35 in my hands to be able to do these procedures. So I'll be happy to do your body contouring procedures. Put in your information in the bottom left of the screen there. We will reach out to you and we'll take care of you. All right. Thank you very much, everybody, for sending your gifts. I appreciate that. Maite Flores 1454. Is there any way you can give us an idea of how much a drainless tummy tuck is? Yes, it starts at $11,500. It's probably anywhere between that and $13,000 on average, depending on the previous surgeries you've had. If you have a lot of scar tissue, because it will take a little bit longer, be more meticulous. Now, if you want to tack on, for example, some liposuction, some fat transfer, the price will be adjusted. But it starts at $11,500. Like I said, $11,500, $13,000 is usually the starting price for the drainless tummy tuck, and that includes anesthesia, facility, garments, follow-ups, surgeries, surgeon's fees, and all-inclusive. The only thing that it doesn't include is your medications, usually that your insurance should cover. But putting your information in the bottom left of the screen, and we will be happy to reach out to you. My patient coordinator will get more information from you to be able to get you, some estimates as well, and help you with your process and your journey. We offer 4 types of financing options: Care Credit, Charity Financing, Alphion, and Patient Fi. Exotica. Have you heard anything about snatched plastic surgery? So snatched is kind of like a term that people use, especially when we do the liposuction of the love handles, back, and the belly area to really get that waistline in. Yes, and we include that in our Lipo 360 patients. So you kind of just tell us how aggressive you'd like for us to be with your liposuction, and we can definitely do that. So user long number is saying, when can you start getting a massage after a tummy tuck? So for the drainless tummy tuck that I perform, my patients don't really need lymphatic drainage treatments because, like I said, the technique is really nice to where it really minimizes the amount of swelling that you have. And I also put you in a binder. You don't need a faja. However, if you would like to get a lymphatic drainage treatment after the drainless tummy tuck, absolutely you can, and it will help. But it's not required. I require it if I do liposuction because that's where you're really going to get more swelling. So you can start typically within a week after your surgery. You should be able to start doing the lymphatic drainage treatments. Typically, if you start much earlier, it's a little bit uncomfortable because you're still sore from surgery. But overall, you can start within that first week. Princess P is asking, do you do BBL as well? Yes, I do. I do the fat transfer to the hip dips and the buttock area. It all depends on where my patients want to have it done. A lot of my patients will come in and they'll say they don't want like a huge change. They don't want the Kim Kardashian, but they want natural. They want a little bit of fullness around the hip dips. And so I'm able to tailor each result based on the patient's needs. And so we discussed that during the consultation. I'm able to examine you, see where I can get that fat from, and have a better idea of how much fat we need to be able to get you the results that you want. You'll be in Houston in May. Wonderful. Schedule your consultation if you have not already, unless you're coming in May to see me. But thank you. I'm looking forward to it. All right, let's see here. How long is the procedure for a 360 drainless tummy tuck? So the 360 drainless tummy tuck is kind of like a body lift is what I call it. So it extends the incision from the front all the way to the back, to the butt crack. So that really helps to elevate the sagging skin in the butt area and the hip area to really give you a much better profile. And then some patients will want to actually get some fullness there and tack on a BBL to that. So we'll do some liposuction and then inject the fat in the butt area and the hip area to really give them much nicer contour. So let me get to your answer, to the answer to your question. Body lift, so 360 drainless tummy tuck, typically takes me around 4 to 5 hours. To do that procedure, depending on whether or not you've had previous surgeries, if you have a hernia that I need to repair, if you've had C-sections, hysterectomies, gallbladder removal, those types of surgeries make it a little bit longer because there's a lot of scar tissue, and I have to make sure that I remove that scar tissue and make everything look nice. But on average, it's about 4 to 5 hours. And you come out with a very nice contour. So no D, like no drains? No drains at all. I don't do any. Oh, so no drainage massage. No, if you are getting the drainless tummy tuck as a standalone procedure, I do not require that you get the that you get the lymphatic massages. However, if you're combining it with liposuction, you're getting the BBL, then yes, I would want you to get those massages because it's really going to help accelerate your healing process as well. So, okay, Mona Talamontes is saying, I'm really interested in the tummy tuck. Not only do I do the tummy tuck, I actually do it drainless, a drainless technique, which actually makes your recovery process a lot smoother and easier. If you haven't been on my content before, please go ahead and scroll through my TikTok content. Excuse me. I have a lot of educational videos. I also have some testimonials from patients who explain their process. I've had some patients who've been on TikTok, who've been following me for 6 months to a year, and then they come in and get their procedure. They also share their testimonials. So please go through the videos. You got people who are walking upright, straight within a week after surgery. Usually it's within 3 days. The majority of my patients, it should be working 3 days. The patient I operated on last week, she was walking straight from the first day on, and then she was on the treadmill at day 4, walking 5 minutes on, 5 minutes off, 5 minutes on, 5 minutes off, looking fantastic. I saw her 5 days after her surgery. She's looking great. There's swelling that's normal. And she was able to actually travel back to Florida. So 5 days is all it took for her to stay in Houston, Texas, for me to make sure that she's doing well, and she was able to head out. So my dear Flores, I just answered that question. Again, for the drainless tummy tuck is usually it's around 11,500 to 13,000. That's kind of like a safe estimate. It can vary based on the number of procedures you've had before. If you've got a lot of scar tissue, it just takes longer for me to do that. So that's factored into the price as well. But it's usually around there. Wonderful, wonderful. Hello. How are you? Let me see. I'm going to try my Arabic here. Why can't I get to that comment? There we go. I've been learning a little bit of Arabic, which I find pretty cool. And I think this is Abdali who's saying hi. But for some reason, there we go. Finally, it came out. So Abdali, I think I got it right. Hi, thank you for joining. Ask your questions, okay? Always happy to answer, to try to get you guys some good information here, some good value. Doc Hollywood, do athletic people heal faster after a 360? People who are fit tend to heal faster in general. It's not the sole factor, but definitely if you're fit, healthy, you tend to heal a lot faster after 360, yes. The bougie way, can you do a tummy tuck without the muscle repair? Yes, you can. It's extremely rare that somebody does not need the muscle repair, but if you don't want it, yes, absolutely, we can do it. Now, if I'm operating and I see that you have a really wide muscle separation, I will fix it because it's going to give you much better positioning of those muscles and better function of those muscles than if it's really wide and not really in the position where it needs to be. But absolutely, you can get a tummy tuck without getting a muscle repair. Yeah. Cabs 215. What do yellow eyes after surgery mean? I have no idea. I'm not sure what surgery you've had. So definitely contact your surgeon and ask them what's going on, if there's any reason why your eyes are yellow. LaWanda Wilson, guys, remember, you get what you pay for. Absolutely. This is your body. You want the best. You want the best price come with it. Yeah, yeah. So, if you want the best, the price comes with it. Absolutely. So I appreciate that, LaWanda. Yes. So a lot of people will say, they can find certain procedures for much cheaper. I'm not here to dissuade you from going to wherever you want. It's your body. What I'm trying to make sure is that you do your due diligence and that you're safe. We get a lot of stories where people go and get surgery and it's cheap. They either don't survive or they get injured or have really bad results. And then they come in and seek revision. And it's really tough to try to fix that. So my advice to you is do your research. Make sure that you're picking a board certified plastic surgeon to do your surgery. If you feel like the price is expensive, but you want to have that person do your surgery, just hold off and save your money. It is much better to do it that way than to go to like a Walmart of plastic surgery where you're just kind of like on the belt line and it just kind of like process you like a number and not really care about you or do the work that needs to be done. We've had a lot of horror stories. So please do your research, and we will be happy to take care of you if you'd like to come in for us to see you and work on you and work with you. And we'll be happy to take care of you, okay? Okay, Abdali is asking, how much is a tummy tuck? So it starts around 11,500 to 13,000. Usually that's kind of like the ballpark. It could be a little bit more depending on what types of surgeries you've had before, if there's a lot of scar tissue, because it extends the time of the surgery procedure and the time you have to factor in anesthesia and facility. They bill by the minute. So the longer the surgery takes, the higher that bill is. So we usually are able to get things done within a certain amount of time. Usually a drainage tummy tuck would take me anywhere between 2 to 3 hours, depending on, like I said, if you need to fix hernias, remove a lot of scar tissue, if you've had multiple previous surgeries. But that's the ballpark, okay? And we'll be happy to take care of you. All right, let's see. Who's just joined us? Miss Oni, our virtual consultations available for out-of-state patients? Absolutely. We start with virtual consultations for all of our out-of-state patients and out-of-country patients who are not able to come in for a in-person consultation. And like just last week, like I said, I had a patient come in from Florida. We started the process with virtual consultation. This week, we had a patient coming from Tennessee. we started the process with a virtual consultation. We get people that come from all over the US. So we'll be happy to take care of you. Put in your information in the bottom left of the screen there. There should be a form that you can fill. And also share the link with any friends that you may know who are interested in wanting to have surgery. Snapper Junior 08. I need all the help I can get. I'm 5'6", 215. How much more do I need to lose to get Lipo 360? Okay, 5'6", 215 pounds. You're pretty much there. You're at a BMI of 35, which is the cutoff for me to be able to do Lipo 360. However, what I tell my patients is the more weight you can lose before the surgery, the better it is going to be for you long-term to maintain those results. If you don't change your lifestyle, we can do the liposuction, which is going to be a contouring procedure. But if you don't change your lifestyle, you're at high risk of gaining weight. Gaining that weight is going to actually change those results. So you'll end up coming back for other types of procedures and surgery. So my response to you is you're at a BMI of 35. We can absolutely move forward and do your liposuction and get your Lipo 360 in. However, if you're wanting to lose, 10 pounds, 15 pounds, keep doing that. You can come in for your consultation now. Usually 10, 15 pounds, you can lose that within 3 months very easily. So the quote that we give you is good for 6 months, and we can definitely get you now, see you, and then plan for the next 2 to 3 months to have you come in and get your surgery done. That way we can book your procedure and reserve the dates for you. Wonderful. Well, congratulations on your weight loss, okay? We'll be happy to do your contouring as well. Hey, everybody on Instagram, thank you for joining us. Don't be shy, ask your questions, okay? And also you guys on YouTube. Okay, let's see here. If I miss your question, please try to repost it, and I'll try to get to it. So how long is the recovery? For the drainless tummy tuck, most patients within 3 to 5 days are walking upright. They come to see me usually around a week after surgery. You're off your pain meds by then, walking upright. A lot of my patients will actually drive themselves into the office on their own. You're back working usually within that first week. If it's a desk job, remote job, no heavy lifting, any kind of strenuous activity. Okay, I'm gonna get you your answer, Tina. Okay, and DM me your information, and we will reach out to you. Okay, she may not have received your message, but otherwise write this number down: 281-724-3138. Text that message. She should be able to get back to you immediately. I know last week we were gone. We were out of town for a conference, so it may have been maybe missed with that, but definitely we'll be happy to take care of you. Okay, DM us. I'm usually more active on TikTok, but DM us on Instagram, 281-724-3138. Okay, and we'll get back to you and get you in. Okay, wonderful. All right. So what do we have here? You're welcome. You're welcome. Let me type this number in, or just DM me. Okay. But this is our phone number, and I think you said you've been calling 724. You too. Have a great evening. 3138. Take care. Okay. All right. The recovery. Oh, yeah. So we're talking about the recovery. So usually you're back at work within that first week after surgery, as long as not any strenuous activity. You'll be back at the gym doing some light aerobic activities, so walking on a treadmill, things like that, usually at week 2. And by the time you get to 6 weeks after, you're in the gym doing some light resistance training. So the recovery for the drainless tummy tuck is fairly quick. Okay, so Rara is asking how much for the extended tummy tuck and BBL. I don't have that pricing with me. Please contact my office. Put in your information in the bottom left of the screen there. My patient coordinator will be able to give you some estimates so that you can start preparing your budget and book your surgery. Well, book your consultation first. We can get the consultation done, and then I'll know exactly what needs to be done, and then we can book your surgery. Angela Mendez. What surgeries are recommended for someone who's lost 150 pounds, extra skin, a lower stomach, thighs, and arm? So, in other words, for those extreme nice body transformations, we're going to have to stage those procedures. We can't do all of that at once. It's way too much surgery for your body to heal well. So you pretty much said everything. So for your lower extra skin on your lower stomach, in your arms and thighs, you'll want to do but with 150-pound weight loss, I think you'll want to get that body lift. So, which is the 360 tummy tuck. It's a combination in my hands of the drainless tummy tuck, hip lift, and butt lift. You'll also want to get a arm lift. Usually, the incision will go from the elbow to the armpit to really get rid of the excess loose skin that's there and whatever little fat is there as well. And then also for the thighs, it's most likely going to be the incision that goes in the groin all the way down to the knee. So you're going to get a thigh lift is what you're going to get, okay? That's a minimum without seeing you, and based on what you mentioned, that's what I would recommend that you get. But I would separate that into at least 2 different surgeries for your body to heal well and do well, okay? What about women with lipedema? Is Keto Kelly 5 is asking. What I would recommend is that you find a center that specializes in lipedema. Oh, so that's some accumulation of fat in the lower extremities and the legs, ankles, calves, and things like that. There are some centers that specifically treat lipedema. So definitely, definitely means that you definitely contact them and get them, okay? Does that mean that you don't do an abdominoplasty? For what? I may have missed it. I do an abdominoplasty. That's the surgical name for a tummy tuck. So I do it drainless. But I'm not sure what you were asking there. But an abdominoplasty is a tummy tuck. It's the surgical name, medical name for a tummy tuck. AV Scott 2 is asking, is there an age cutoff? There is not. I've operated on patients in their 50s, 60s, and 70s, and they have done very well. Orchids is asking, how much does it cost? So the drainless tummy tuck is $11,500 to about $13,000. Usually that's the ballpark. Mommy makeovers vary. It can be anywhere between $15,000 to $30,000, depending on all the procedures that you put in. And that includes anesthesia, facility, and surgeon's cost, surgeon's fees. Okay, very good. I've had 3 C-sections. Prisiyamani. I've had 3 C-sections. Would that make it longer? It makes it a little bit longer because it is tedious. Say for example, I am going to be posting these videos that I've done. It just takes time for me to process everything and get everything in. But I've had most recently a patient who had a vertical C-section scar. So it goes from the belly button all the way down to the Mons area. So it takes time for me to remove that scar tissue. So for you, we would definitely adjust this, the quote to take that into consideration. I've operated on patients who've had hysterectomy scars, multiple C-section scars. I've had some who had the C-section this way and the C-section that way. I've had people who've had large scars on their belly from removing their appendix, from removing their gallbladders, and I take care of that. So you'll be fine. You'll be fine. So we'll be happy to take care of you. Just put in your information in the bottom left of the screen there, and we will reach out to you and take care of you. Okay, so Happy Flower is asking, do I have to wait until lower BMI to get an in-person consultation? You do not have to wait. As long as the weight that you need to lose is well within reach, like for example, if you're going to be losing that weight within the next 2 to 3 months, you don't have to wait till you get there to get your consultation. Just keep on your path, come in to see us, lose the weight, and then when you see us, we're going to be able to talk and see how you're progressing and schedule your surgery. Again, when you come to see us, we give you the quote, it's good for 6 months. So if you feel like you're going to absolutely reach that goal weight well within the 6 months, you can come and see us. And then we'll be able to get you in for your in-person consultation, and also make sure that the plan that you're wanting to have done and the surgeries you want to have done will be good. Wonderful. Okay. Vicky Ayuso is asking, can you do a tummy tuck, lipo, and eyelid surgery at the same time? Because you want to do it once. Yes. And I've done that on patients before. And I've also posted that on my TikTok, and you can see the results as well. But yes, definitely, we can do that. Oh, you're coming there in September. Wonderful. Looking forward to seeing you. I know you've been following us and asking a lot of questions for the past couple of months. So it's nice to be able to get you ready for your surgery. And we're looking forward to taking care of you. Okay. Wonderful. All right. Let's see here. That Zep Mama. I have a lot of upper loose skin, but really don't want to do a fleur-de-lis tummy tuck. Okay, so I always tell my patients what limitations are if we do just a regular tummy tuck. And I also tell them if they want the maximum results and they are a candidate for the fleur-de-lis, I recommend the fleur-de-lis. But I will never do a fleur-de-lis if you don't want the vertical scar. I always tell my patients, you have to be comfortable with having that vertical scar. If you don't want it, I'm okay. As long as you're comfortable with that. I've had quite a few patients who've come in who would do much better if they had the fleur-de-lis with the vertical scar, but they didn't want it. And so I tell them, hey, look, you're going to still have some excess skin in the side-to-side direction, but if you're happy with that, that's fine. So we want to make sure that we take care of you and get you the information so that you know what decision you can make. And if you're okay with that, I'm happy doing the procedure and avoiding a scar for you, because it is your body. I want you to be happy. If you get that tummy tuck and the scar is nice and low, we do the drainage technique. And then later on you say, you know what, I really don't like how this excess skin is and I would like to get it removed. We can always come in and do that procedure to bring that skin back in and complete the fleur-de-lis. So you haven't really burnt bridges, I would say, in that case. But for my patients, like I said, I offer it. I discuss the various reasons, and some of them say, I don't want the vertical scar, and that's fine. We don't have to put it in. We don't have to put the vertical scar. And that's the way I practice my surgical practice. I want to make sure that I explain to you guys what the limitations are based on every procedure that you're wanting to have done. I'll try to have a good understanding of what results you want. And then we have that discussion and I can actually explain more. And then we decide together what is best based on your individual needs. So if you don't want the vertical scar, I wouldn't put the vertical scar for you. Melissa P. Soso. When could I get back to work as a masseuse after a full tummy tuck, roughly? So the fastest with the drainage technique will probably be, because masseuse, you're going to be applying a lot of pressure, moving a lot. I would say 4 weeks to very roughly 3 weeks. 4 weeks. You might feel better and you might start at 3 weeks. But I would probably give you 4 weeks because you really need to. That's a lot more involved. But the drainage technique will definitely help you recover a lot faster. All right, so let's see here. Rayla Robinson is asking, what is the safest BMI for approval for surgery? So in my hands, when I do these body contouring procedures, I want your BMI to be less than 35. That's the highest BMI. Now you're asking for the safest BMI for approval. I would say, a good target is probably a BMI of 28 or less. Like a 25, 26, 27, 28. Those would be nice ranges. The maximum is a BMI of 35. Contact us and we'll be happy to discuss this in further detail, okay, and guide you through the process. All right, let's see here. Okay, Miriam is asking how much for arm lipo and lipo 360. I don't have those prices with me. Please contact me. Phone number is right there, or put your information in the bottom left of the screen. My patient coordinator will be able to get some information from you and get you some estimates. Okay, that way you can start budgeting and get ready for your body transformation. Lachelle Bryant is asking, what is the BMI requirement for body contouring? That's what I was just answering for Rayla Robinson. 35 is the max. Ideally, like I was saying, is a BMI probably around 25 to 28 would be ideal, but the max BMI is 35 for these body contouring procedures. All right, so answered that. Let's see here. Okay. Great question by B. Anderton. Can you do a tummy tuck and a thigh lift during the same surgery, or do you recommend separating? So if the thigh lift is the crescent thigh lift, in which case I put the incision just in the groin area. We don't have to go all the way down to the thigh. I can combine the tummy tuck and that thigh lift. If we have to go all the way down to the knee, I will separate it because it's demanding too much of your body to be able to heal to do both the tummy tuck and that long extended scar surgery to the knees. So that I would separate it if it's that one. But otherwise, if it's a crescent, like I said, in my hands, I can do both. And the main reason I don't do all of it together is for your recovery. So it's for your body to actually be able to heal, minimizing the wound healing problems. So opening up of your incisions, for it to take more time, because doing the thigh surgery, there is already an increased risk of wound healing problems just by nature of, the excess skin, the fat there. The groin is not the cleanest area. There's a lot of sweating, a lot of bacteria there. So it is prone to more healing problems. So definitely we want to make sure to maximize your healing process. So there you go. All right, great question. Oh, okay, Glenn. So you did Nicole Zavala's body. I not sure I recognize that name, and plus I wouldn't be able to share that information unless that patient came on and discussed things, just for HIPAA reasons. Seal Marie 2, sorry, just joined. What type of post-pain control? Okay, so when I do the during this tummy tuck, I inject Exparel for all of my patients in the incision, also in the area where I did the muscle repair. So that really helps to reduce your pain level and also reduce the need for pain medication. Otherwise, I would put you on some narcotic pain medication and some nerve pain medication. And most of my patients will recover. Usually they'll wean off their pain meds within 3 to 5 days. They're off of their pain meds and they're walking upright. And by the time they come back to see me a week later, they're feeling much better. They will probably drive themselves. A good number of them will drive themselves into the appointment, which is fantastic. That means they're off their pain meds, feeling much better. All right, so let's see here. Colostomy scar. Is that a contraindication for a mommy makeover? Good question. It all depends on where exactly that scar is, how much loose skin you have, if we can actually remove that, or if we feel like there's going to be a huge risk of the skin dying. So I can't really answer that question without actually examining you and seeing what we're dealing with. But it's not necessarily a contraindication. It depends. All right, let me answer a couple more questions. Okay, good. Thank you for the follow-up question. Okay, yes. Okay, for specific diets, whatever diet works for you. I don't have a specific diet for you to lose weight from a BMI of 42 to 30. I feel like when people get onto like a diet, it is difficult for them to actually maintain it. So what I tell our patients is increase your activity level. So the question is, let me ask for everybody. This is on Instagram. Do you suggest a specific diet uh, to drop below a BMI of 30 if your BMI is 42? So, like I said, I feel like getting on a diet is difficult. What I tell most of my patients is reduce the number of portions, the portion size that you eat, increase your level of activity. You have to do at least those two, and get more active, get more exercise, and walk regularly. Start wherever you can. If you can do 30 minutes a day, start there. If you can't, do 15 minutes a day. And then gradually over time, increase that level of activity. Walking, maybe even doing different types of things, maybe the elliptical, other types of exercises. But do something where you can cut out, excess sugars, desserts, soda pops, Coca-Colas, and we call that Cokes in the South. Soda pop is probably more like Midwestern. Anyways, any kind of sweet carbonated drinks, things like that, desserts. Reduce it significantly, but you don't have to necessarily cut it out of your whole life, because I feel like you still have to be able to enjoy some food. Just moderation, really reduce it, enjoy it, and then keep at it. Consistency is very important. Follow-up question: can you do bra and back fat lipo as well as the lipo of the stomach? Yes, you can combine all of those at the same time, and that's what I would do for a lipo 360. Thank you for your questions, Raymond Robinsons. I appreciate it. Let's see here. Let me answer some more questions here. Hey, Jackie Marie, nice to see you. Thank you for joining us. Another patient of mine from Louisiana. All right, let's see here. Monice, the drainless tummy tuck mommy makeover 360. What's the usual healing time and scar of the drain T? Scared of the drain T. I'm not sure what the drain T is. I think it got cut off. So the drainless tummy tuck mommy makeover recovery is the usual healing time. So you're combining up with 360, say for example, with the drainless tummy tuck. The healing time, you'll be usually around 7 to 10 days. So 1 to 2 weeks, and then you'll be feeling much better to be able to go back to work, drive. You'll definitely be off your pain meds, although everybody's different. Some patients wean off the pain meds earlier. Some patients need a little bit more. Everybody's different. So we'll definitely be discussing that and adjusting based on your pain level. As far as like being scared of the tummy tuck, so are you scared about the drainless tummy tuck? Let me know why you're scared. And then we can address those and explain a little bit more. The drainless tummy tuck is a safe procedure. It actually allows you to recover a lot faster than a typical tummy tuck, the traditional tummy tuck, where the surgeons put the drains in. It reduces your risk of infection and seromas, fluid collections, and things like that, and makes your recovery a lot easier. Okay, so Vicky Aisu is asking, what is the difference between a facelift and face rejuvenating? So a facelift is a particular surgical procedure that is part of facial rejuvenation. Facial rejuvenation can include many, many things. It can be some Botox or Dysport. It can be some skin tightening. It can be a brow lift. An eyebrow lift. It could be a forehead reduction. It can be fat transfer to the face. So there's a lot. It's kind of like a big category, facial rejuvenation. Facelift is one type of procedure that falls under the umbrella of facial rejuvenation. All right, so let's see here. A couple more questions. Once we hit the hour, I will have to say good night. Hey, Redbone247, how are you doing? Hi, Dr. D. It's been a while. I hope all is well. Okay, so Sweet J is saying, can I get a tummy tuck with sleep apnea? It depends on how severe your sleep apnea is, if you have any other comorbidities, and what your BMI is. Otherwise, if you have like a CPAP machine, you're healthy otherwise, and you have an acceptable BMI, less than 35, we should be able to move forward with a tummy tuck. Yeah. Bree, hi doctor. I've lost 175 pounds and maintained for 3 years. Congratulations. My insurance covers the paniculectomy. Do you do you take insurance? Unfortunately, I do not. I don't take insurance. My patients who come in who want me to do their paniculectomy, they will pay out of pocket and then get the insurance to reimburse them. So, in other words, if you were to come to me, I would be considered out of network. So I'm not sure if your insurance would cover that or give you some kind of reimbursement. You would have to discuss it with them. But like I said, the patients that come to see me, hey, KD702, thank you for joining. Those who come in to see me and who want me to be their surgeon for their paniculectomies, they pay out of pocket. And then they discuss with their insurance to see if they can get some kind of reimbursement. You're very welcome, Sweet Jay. Wonderful. Okay, so we got another question here. How long is the recovery for brachioplasty? Great question. So usually around 2 to 3 weeks. Most patients will tell me that when they get, so this is for the long arm lift. So the scar that goes from the elbow to the armpit. If you only get the short brachioplasty, it's a much faster recovery. So for the long scar, most patients tell me that by week 3 is when they feel like the arms are kind of like normal again. They don't feel heavy, odd, and things like that. Because of course you're still wearing the compression garments and things, and that, and getting lymphatic massages to really help that recovery process. Because for my patients, when I do the arm lift, it's not just removing the skin. I also do liposuction of the arm to contour it and make it look nice. So it's a combination of liposuction with the arm lift that is all included in your brachioplasty procedure. So about 2 to 3 weeks is what your recovery is. As far as going back to work, usually within a week you're back at work. It's fine. But the actual wanting to feel, feeling like your arms are normal again, you feel good, it's usually around 3 weeks is what my patients tell me. You will still continue to see much more improvement as the weeks go by. All right, let's see here. Okay, good. So they do cover out of network. Then I think that should be fine. Come and see us, and we'll see what we can do. You're very welcome, and I wish you well. Hopefully, you can come in. And we can actually do your procedure. Most of my patients will actually want to get the full tummy tuck, especially if you've lost 175 pounds. It depends on what your current BMI is and what the excess skin is. So we can do the full tummy tuck if you're a candidate, and then hopefully the insurance will be able to cover and reimburse you for the paniculectomy part. But you're very welcome. Thank you for asking, and thank you for participating. Always appreciate that. Hey, we got some new people coming in. Jamie, all right, thank you for joining. Lestinia just joined. Welcome. All right, let me see. All right, thank you guys for joining. I appreciate it. Okay, let's take one more question, and I am going to wish you guys a wonderful evening. I do have a procedure tomorrow. We are starting to work more towards providing some body contouring procedures under local anesthesia. We're starting small because we want to make sure that our patients are comfortable. And as we get more and more experience with being able to do that, we may be able to expand to more procedures that we can do under local anesthesia. I know a lot of you guys have asked about that. And so definitely be on the lookout for more capabilities in our office to be able to do more procedures under local anesthesia. Right now, the ones that we do are ears. We work on ears, earlobe repairs. We do setbacks of the ears under local anesthesia. We do upper eyelids. We do lipoma removals, which is our fat collection of cells underneath the skin. We do some scar revisions. We do breast implant removal. We do some small breast lifts under local anesthesia. We also do labiaplasty under local anesthesia. I'm trying to see what else we do. So now we're going to be offering liposuction, small liposuction to start off with, because we can't do a full 360 yet. We definitely want to be able to make sure everybody's safe and healthy, and it all depends on how much we need to numb you. That's kind of like the limiting aspect of it. But yeah, good. All right. Thank you, everybody. If you don't follow us or on TikTok or YouTube or Instagram, please go ahead and like us, follow us. Deigni Plastic Surgery is the handle on all platforms. I do these Q&A sessions every Tuesday and Thursday, time permitting. Usually I start around 7 p.m. Central Standard Time. But again, it all depends on the timing. So as we move towards, we're definitely in spring now with the pollen coming out, move towards summertime, we may extend it to a later time. But regardless, I wish you guys a great night. God bless you. Have a wonderful weekend, everybody. And until next time, take care. Bye-bye. Okay, everybody. Thank you so much for joining us. Have a good night. God bless you. Thank you very much, YouTube. And until next time, bye-bye.